Good day, everyone. My name is Krislyn Ebrona, and I was assigned to discuss about the trigger 1 mammography. So here's the trigger. Lara is 45 years old, and she experienced symptoms such as amenorrhea and oligomenorrhea, mood change, and night sweats. She noticed that her breast has started to sag, and the area surrounding her nipples become smaller. She decided to undergo a mammographic procedure as per the request of her physician. Upon her arrival in the radiology department, she was welcomed by the mammographer who checked her breast and its clock face reference. She also mentioned about a lump in the upper inner quadrant of her breast. So first, we will discuss what is mammography. Mammography is a specialized medical imaging that uses a low dose of X-ray to examine the breast for the early detection of cancer and other breast diseases. So the recent advances in mammography includes digital mammography, computer-aided detection, and breast tomosynthesis. First is the digital mammography, also called full-field digital mammography. It is a mammography system in which the X-ray film is replaced by the electronics that converts X-ray into mammographic pictures of the breast. The image of the breast are transferred and stored to a computer and can easily shared electronically, allowing multiple providers to share necessary data in order to improve your care. So in this screening, is gonna pick up lang niya ang important information and abnormalities sa breast tissue and eliminate what is irrelevant. Next is the computerized aided detection or CAD. It is a system search digitized mammographic images for abnormal areas of density, mass, or calcification that indicate the presence of cancer. CAD system highlights these areas on the images, alerting the radiologist carefully assess this area. So during developing of the mammographic image, is gonna reduce na po niya ang reading time and at the same time prevent errors. And the last one is the breast tomosynthesis. It is also called three-dimensional or 3D mammography and digital breast tomosynthesis. It is an advanced form of the breast from different angles are captured and reconstructed into three-dimensional image set. The 3D representation of the breast is similar to the 3D images that creates by standard CT technology, in which series of thin slices are assembled. So there are two types of mammogram that we perform. One is the screening mammography and the other one is the diagnostic mammography. Screening mammography detects early breast cancer in women experiencing no symptoms, while the diagnostic mammography, it detects breast diseases in women experiencing symptoms such as a lump, pain, skin dimpling, or nipple discharge. These two types of mammogram use same machines. However, diagnostic mammography takes longer to perform than screening mammography. And since ginagamitan man si diagnostic og additional mammographic images, so ang iyang total dose of radiation is high. Imaging equipment. Dedicated mammography equipment, specialized X-ray tubes, optimized screen film detector system, and breast compression devices. So during a mammogram, a patient breast is placed on a flat support plate and compressed with a parallel plate called a paddle. An X-ray machine produces a small burst of X-rays that pass through the breast to a detector located on the opposite side. The detector can be either a photographic film plate, which captures the X-ray image on the film, or a solid-state detector, which transmits electronic signals to a computer to form a digital image. The image produced called the mammograms. So the levels of density are often recorded in mammogram, reporting using letters A, B, C, and D. Letter A, it is a fatty breast density, as you can see in the image, in the radiographic image. It indicates that the breasts are almost entirely composed of fat. And about 1 in 10 women have these results. And the letter B, it is a scattered breast density. It indicates that there are some scattered areas of density, but the majority of the breast tissue is non-dense. About 4 in 10 women have these results. And letter C is the heterogeneous breast density. It indicates that there are some areas of non-dense tissue, but the area of majority of the breast tissue is dense. About 4 in 10 women have these results. And letter D, dense breast density. It indicates that nearly all of the breast tissue is dense. About 1 in 10 women have these results. So there are standard radiographic views of the breast. These are craniocaudal view, the right craniocaudal and the left craniocaudal, and the medial lateral oblique, the right mediolateral and the left mediolateral. So the guide questions, number 1. Is there any difference between male and female breast? How do they differ? Both males and females have breasts. The structure of male breast is nearly identical to that of the female breast, except that the male breast tissue lacks specialized lobules, as there is no physiologic need for milk production by the male breast. Guide question number 2. What specific development stage Lara has experienced? Lara is experiencing the menopausal stage. By the time a woman reaches her late 40s and early 50s, perimenopause is starting. At this time, the levels of estrogen and progesterone begin to change. Estrogen levels dramatically decrease. This leads to many of the symptoms commonly linked to menopause. Without estrogen, the breast connective tissues becomes dehydrated and is no longer elastic. The breast tissue, which was prepared to make milk, shrinks and loses shape. This leads to the saggy. So, based on Lara's condition, where she experiences symptoms such as amenorrhea, oligomenorrhea, mood change, and night sweats, this indicates that she is now in her menopausal stage. What are the different development stages? These are the fetal, puberty, menstruation, pregnancy, lactation, menopause, and postmenopause stage. Number 4, guide question. Is there any changes that will happen to the breast during developmental stages? What are those changes? So during birth stage, breast development begins while a female baby is still a fetus. By the time she's born, she will have already started forming nipples and milk ducts. During puberty stage, normal puberty in girls can start as early as 8 years old and as late as 13 years old. When your ovaries start creating estrogen, this results in your breast tissues gaining fat. This additional fat causes your breast to begin to grow larger. This is also when the milk ducts grow. Once you start ovulating and have a menstrual cycle, The milk ducts will form glands. These are called secretory glands. During menstruation, many women also have changes in breast texture. With breast feeling lumpy, these are the glands in the breast enlarging to get ready for a possible pregnancy. If pregnancy does not occur, the breasts return to normal size. Once menstruation begins, the cycle starts again. During pregnancy, many women experience breast changes in early pregnancy. In fact, it's often the first sign you're pregnant. Surging hormones and the shift in breast structure means your nipples and breast may feel sensitive and tender from as early as 3 or 4 weeks. Some moms to be have sore breasts during pregnancy right up until the birth, but for most it subsides after the first trimester. During lactation, the size and shape of the breast can change. Breast size is determined by how much fatty tissue there is. Making milk creates denser tissue in your breasts. After breastfeeding, both the fatty tissue and connective tissue in the breast may shift. Your breast may or may not return to their pre-breastfeeding size or shape. Some women's breasts stay large and others shrink, but sagging. Menopausal stage. Usually women begin to reach menopause around age 50, but it can start earlier for some. During menopause, your body won't produce as much estrogen and that will affect your breasts. They won't be as elastic and may decrease in size, which can cause sagging. However, if you're being treated with hormone therapy, you may experience the same symptoms you had during menstrual cycles. Guide question number 5. What is clock face reference in the breast and what is important to breast imaging? Clock face method is another way to describe a breast location, in which the location of breast finding is described as top of clock were superimposed on each breast as the woman faces the examiner. This means that the upper outer quadrant in the right breast is between the 9 and the 12 o'clock positions, but the upper outer quadrant in the left breast is between the 12 and 3 o'clock positions. Upper inner quadrant was mentioned in the trigger. What are the other quadrants at the breast? As a single breast can be divided into 4 quadrants. These are the upper outer, upper inner, lower outer, and the lower inner quadrant, by 2 perpendicular planes intersected at the nipple. Guide question number 7. As for the anatomy, what composes the breast? The breast is composed of glandular structures called lobules. In women, the lobules are composed of specialized tissue which can produce milk during periods of lactation. The lobules themselves are organized into lobes. Each lobe contains 15 to 20 lobules. So that's all, and thank you for listening. God bless.